Hi there, welcome to another installment on My Ultrasound Diaries. So on this day, I scanned a 20-year-old female with a history of severe lower abdominal pain and brownish vaginal discharge that will be sometimes mixed with blood. On examination, there was suprapubic tenderness noted. Now the physician sent this patient for a scan to rule out an inflamed appendix. However, these are my findings when I examined the patient. The liver, the kidneys, the pancreas, the spleen and the bowel appeared normal. There was no significant tenderness in the right iliac fossa as compared with that in the suprapubic region. No inflamed appendix was seen. There were no collections in the paracolid gutters. No unusual masses in the right and left iliac fossa or in the right and left adnexia. However, there was a notable finding in the suprapubic region, and this is it in the next slide. So what I saw that you are seeing now is copious anechoic fluid collection behind the uterus in a space we would usually call the pouch of Douglas or the retrouterine pouch. The fluid level was quite significant, with a depth of up to 25 millimeters. Now, fluid in the pouch of Douglas could suggest a number of physiological and pathological conditions, which include ruptured cysts of follicles, ectopic pregnancy, pelvic inflammatory disease, ascites, molar pregnancy, and so forth. However, when we factor in the history of lower abdominal pain, abnormal vaginal discharge, abnormal bleeding by vagina, the most fitting impression will be pelvic inflammatory disease. So here is my report. Significant clear fluid is visualized in the retrouterine pouch, that is the pouch of Douglas, to a depth of approximately 25 millimeters. No midline or adnexial mass or cyst is seen. An inflamed appendix is also not visualized. Impression: significant POD, that is pouch of Douglas fluid. Keep in view pelvic inflammatory disease. Stay tuned for more ultrasound.